Stream. All right, so now we are live. All right, hi everyone. Thank you so much for joining our session today. My name is Krupa and I'm going to be facilitating our virtual shadowing session with Dr. Kapila, who is a general dentist. Thank you so much for joining us today, Dr. Kapila, and whenever you're ready, the floor is yours.
Hey, hi guys. Hi everybody, dental shadowers, all the pre-dental students and everybody else who joined us over here. Thank you so much for inviting me here to speak. I am truly humbled and honored to come on this wonderful platform that is providing so much value to all the pre-dental students. And hopefully we are going to have a wonderful session today. Anytime during the presentation, if you have any questions, please do not hesitate to ask, or during the presentation or in the end, however you guys like it. I am open to both. So yeah, let's get started. See, so yeah, guys, my name is Dr. Neha Kapila. I am a general dentist in Chicago, Illinois. Since 2002, I have been in dentistry in various roles in different practice settings, different practice models, and currently I'm associated with the DSO. I'm also a founder and coach at Dentist Coach, where we provide life business and leadership coaching for dental professionals so they can enjoy this beautiful profession of dentistry and enjoy their personal life without burnout. All right, let's keep going. So for my journey to becoming a general dentist, um, I draw my, so for me, early on, like ever since I was in my teens, I knew that I have to be doing something to make an impact in other people's lives and make a positive difference in their lives, and to be serving other people. This inspiration I draw from my parents. Both of them had been professionals all their lives, and they were in social service all their lives. So for me, I am happiest when I am loving on people. I'm a people person when I'm taking their pain away, when I'm taking care of them. And in India, for me, I was like, okay, that's why I joined medicine. Like, I'll be able to do all these things, and that's the best way to go. And in India, like during high school, either you're gonna be joining medicine or non-medical or commerce or arts. I joined medicine. So I and after high school, I was like, okay, we're gonna go to college. um so I decided to be a dentist because along with all of these things that making an impact, I wanted to make a positive difference. With dentistry, it was like, okay, the flexibility of time and schedule is going to be there. I'm going to be able to work in different practice settings. If I wanted to specialize, dentistry is going to have so many fields. If I wanted to venture out, I can do that. I love teaching. I've always loved teaching. So I was like, okay, if I wanted to be a teacher, maybe within dentistry, I could do that too. And basically maintaining a work-life balance along with taking care of my family is going to be good. So that was my starting point. And like I said, I come from very humble beginning. So I joined dental school in India, and 1997 to 2002, I was in dental school. And once I graduate dental college in India, that's what we call it. So I got my BDS degree and I practiced in India for a year. And then I was basically, guys, once I graduated dental college, I was like, yay, life is good. I'm done with college and now I can stand in my purpose, help people, put smile on people's faces. By that time, I had gone through dental college and all the good stuff. So being a doctor, I'm in a noble profession. So I was like, life is set. So I started over there practicing, but then I guess in 2003 I got engaged, and After that, I got married and moved to US. So I'm like, okay, came to US. Now what? My whole planning was like out of whack. I'm like, okay, now I do want to be in dentistry. I want to be practicing. What am I going to do with my life? Now what? So right off the bat, I remember I came to Wisconsin with my husband. And so I'm like, I cannot just be staying home. I need to start studying. So me and my Kaplan book, we were spending time together. I did my self study, and I within like 5 6 months I gave my NBD part one. But with the visa situation and moving around for the next couple of years, we were like, okay, started our family. I had two beautiful kids. When I was pregnant with my second child, when I got pregnant with my second child, okay, story time. So at that time, then I'm like, okay, what's going on? Like, uh, where is the NBD part two? If I get selected in school, if I go to school, what am I going to do? So I'm like, okay, I started studying while I was pregnant. For my NBD part two, again self study, and I guess I was 9 months pregnant. I was a whole 9 months pregnant, and I go to the Prometric Center to give my NBD part two, and the lady is like, "Honey, you are in the wrong building. The hospital is next door." And I'm like, "No, honey, I'm in the right building. I came here to give my NVIDIA part two, and I'm gonna be here tomorrow too. And you're gonna be seeing me going back and forth to the bathroom multiple times, but I need to get this done." So that's how I gave my NBD part two the first time. So long story short, I gave my NBD part two. I'm like, okay, I'm ready to go to dental school now. After a week, 10 days, I gave birth to my daughter on Christmas Day. So wonderful time for me. I was done with my part two. Both my kids were with me, and really part one and two were done. I was ready to go to school, but I was still on H4 visa at that time. So I'm like, okay, I am. Let's go ahead and apply it to schools. I did not know any better. I did not prepare. Let me tell you what. And I just with those things, I went ahead and applied to schools. Of course, I did not get a lot of interviews. I did get one, but I did not get selected. So I was a little bit disappointed, but then I'm like, okay, we went back home, and then I'm like, okay, well, what should I do? Like that's when my basically my journey to becoming a general dentist in US started. I went back home. I'm like, okay, I just gave my interview, didn't get through. What other things can I do? And I remember we had moved to a very small town in South Carolina at that time. So I was like, okay, I'm gonna start volunteering. I need hands-on experience. I cannot just stay home. I need to be in dental school no matter what. So I remember I made printouts of my resume, a whole bunch of them. And like I said, it was a small town. So I took my resumes in hand, and then I went to so many dental offices in the town, and I gave them my resume. I told them my intent. I am an international dentist, and I want to go to dental school. So I want to be shadowing you, observing you, and I want some experience so I can go to school over here, get my degree. Pretty honest and straightforward. Thank you, Dr. Davis. Shout out to him. He did allow me to come and observe him. I remember for the first couple of weeks, it was just for a couple hours. He was like, okay, just come here and see how we do stuff here in America. And I was very, very excited. I'm like, yay, it starts somewhere. So that's how I started. And then slowly I got to spend more time with him, with his team, learned a lot, not just the clinical side of dentistry, but also the non-clinical side. It was a private practice, so I learned a whole bunch of things about running the business side of dentistry in US too. And then dentistry in India was very, very different. The than practicing over here. So wonderful experience over there. Along with that, I did also, after about a year or so, so like I said, I was very aggressive. I'm like, okay, I will do every single thing that I can in my power to boost my application. And then also I forgot to tell, like, I did still hold my license from India. So every chance I got to go back home, I did do community outreach programs as much as I could, just so that I can keep including it in my resume. Along with that, I did volunteering with a private practice, and then also I joined the oral and maxillofacial surgery office. And with them too, again, the staff was wonderful. Dr. McDonald and tuning, again, that was the office where I went. So I wanted to give shout out to all the people that have helped me in the journey so far, and I'm truly humbled and honored to be learning from them. Those are like my main mentors when I started my journey here. So thank you so much. So along with that, after like 6 more months, by that time it was already a year and a half of like volunteering here and there. And I remember whichever dental, there was a small dental society in that town too, so wherever they all were going, the implant club, this club, that club, I was just following them around. I was their tail. Okay, get me in everywhere. So I could get whatever experience I could get. And also I had applied to be a research assistant at a local college in the biology department. So I did not want to leave any stones unturned. Um, and I am forgetting something. Yes, it will come. So once I did all of that, I'm like, okay, I'm gonna apply, give my CAPID application again. So, and also I did one more thing. By that time it had already been 4 to 5 years since I gave my NBD part 1. So I gave my NBD part 1 again and scored more. So I was like, okay, now I am ready. I am gonna apply to the dental school and I'm gonna get through it. And I applied to University of Colorado, and that was the only school that I applied to. And I'm like, Hail Mary, this seat has my name written on it. I was so positive. I was so stoked. I'm like, okay, I'm gonna go there and I'm gonna kill it, kind of an attitude. So I wanted it so bad. So I'm like, okay, letters of recommendations, the personal statement, everything is all ready and set. My scores are good. So I go there, give my interview, give my bench exam. Oh, and while I was doing all the volunteering and community outreach and observership, I remember I got a compressor back home, a second-hand compressor and handpiece. And I ordered a mannequin head and stand typhodonts models, everything from Amazon. And I was practicing, guys. And I was doing my wax carving, everything, just so that I can give my very best. I can show them that I want to be here. So this is a long story short. This whole story I told because once I went to Colorado, I was so excited, gave everything. And I remember June 5th, 2010, I get this email from the program director, Dr. Town. Thanks again. All the faculty, I got selected in University of Colorado School of Dental Medicine, could not have asked more. um, that was like I said, in hindsight now I think that I should have applied to maybe more schools, but I was blessed that this is like the dream school for me. I learned a lot. The faculty was wonderful. My time in dental school was amazing. So that's how I started. 2012, I graduated from the ISP program, and 2013, we moved to Illinois, and I've been here ever since then. So long. Why did I tell you all this long story? You see, I have had so many ups and downs in my journey. how I started, where I am right now. And I still remember my why. I still hold my purpose very close to my heart. Why did I join dentistry, and why am I still in dentistry? And I do the same thing with my coaching too. If you want something, you just have to keep the grit going and keep on doing whatever you're supposed to, and you're going to be just fine. So for you guys, a little bit of, a couple here years here and there, don't mind it, it's okay. Everybody is going to get somewhere. Every seat has one, there is going to be one seat that is going to have your name written on it. Okay, all right, what is general dentistry? So in simple terms, a general dentist is your primary care dental provider, providing dental home to patients for their comprehensive oral health care needs. Just like primary care physicians, the patient is going to go to them. uh, they see them first. If they can take care of the patient, they do it. If they need to be referred, the primary care physician is going to refer the patient to the specialist. The same thing with general dentistry. We are going to take care of the patients comprehensively. Whatever we cannot do, whatever we need our specialists for, we refer the patients to them. Okay. And these days, like, general dentists do a whole bunch of things. Like, sky is the limit. As long as you are passionate about doing whatever you are doing, you're competent, and you can maintain the same standard of care as the specialist. General dentists these days do a whole bunch of stuff, almost everything. All right. Let's see. Advice for college. Okay, and now we get started with the good part. All right. So I guess, guys, for you pre-dental students, the most important, the main thing is going to be your GPA. When the admissions committee is going to look at your application, of course, your GPA score is going to matter, and then your DAT score is going to matter a lot. But as a whole, the dental schools, they want to see uh, a person who is a student who is going to have a very well-rounded application. You are going to have to show proactiveness, like you are going to be able to show that you are not just a bookworm, you are doing other things too along with me. Look at like dental shadowers, you guys are doing an amazing job. I mean, this is a fantastic thing. Like, you are showing leadership skills, you are showing that you can wear multiple hats. Dentistry is not just clinicals, you're gonna have to manage a whole lot of things. So dental schools want to see a well-rounded person who gives back to the community within dentistry, who is going to be serving the society. And like I said, the more things that you can put a good personal statement, like, they need to see you as a whole, not just you as a student in dentistry. They want to be able to kind of differentiate, because the competition is cutthroat, guys. So you're gonna have to, from the get-go, you're gonna have your application stand out. So I think that is the most important thing. Of course, maybe other people might have said the same thing. And then the next best thing is the shadowing, which again, dental shadowers is providing. Like, during COVID, we are not able to go physically, but then again, this is your blessing in disguise. You're able to not only shadow just one or two dentists, there are like a whole bunch of you coming every single week. So shadow and observe as many dentists as possible. If you can volunteer and work as a dental assistant, it is going to boost your confidence, and it is going to boost your application a whole lot. So I think if you can get that hands-on experience within dentistry, it is going to go a long ways. Along with that, like I said, guys, for me, I did self-study. It was just me, my Kaplan book, and Wikipedia, Google Brother. Those were the only things that I had. I did join Student Doctor Network, and it did help quite a bit. But in hindsight, I feel like when you are actively participating and when you are learning like that, when you're collaborating with all the other pre-dental students, networking with people within dentistry, that is going to be way more beneficial for you than just self-studying, right? Community outreach programs, whatever you can do, like I said, give when it comes to giving back, dental schools look at that very, very positively in your application. Fine motor skills. So dentistry is a very hands-on profession. You are going to be working with your beautiful hands all the time. So fine motor skills, anything that you can do. Like I said, for me, I was already a dentist from India, but still I'm like, okay, but I'm gonna keep on practicing. I'm gonna keep on doing stuff. You're gonna have to work in indirect vision all the time. So all the things that I did, I guess, is gonna be helpful for anyone. Even like just looking at it, and you can take a pencil and then kind of like draw on the maxillary teeth while looking in the mirror. That is going to be very helpful. So things like that. And then wax carving, a lot of people do soap carving, as long as you're not allergic to it, you can try that. Playing with wires, bending wires like we do in orthos. So all these things you can do at home, right, even right now. So try to do that. That is going to be very helpful. But other than that, clinical skills, don't worry about it. Most all dental schools are the same when it comes to the education. The clinical part of dentistry, you are going to learn a whole bunch, and everything clinical you are going to be taught in school, so don't worry about it. Time management, why did I put it over here? Dental school is going to be very, very rigorous. It is. So I know, like, you guys must be doing everything right now too, but still, like, remember to like do your assignments on time. Know how to block time for different things. When you're doing like a whole lot of stuff, you should know how to handle your time wisely, right? Basic business and finance courses. Now, dental schools, for the most part, everywhere, like I said, are going to give you good clinical skills exposure. You're going to learn about dentistry, but when it comes to the business side of dentistry, you don't really learn quite a bit, especially if you are looking forward to going in private practice after dental school. I think taking some business courses, if you can, or finance courses, is going to go a long ways. And also because student loan debt is no joke. And again, if you're going to be starting your private practice right off the bat, this is going to be very, very helpful, because those loans are going to be added on top of it, right? And the next thing that I wanted to add was that apply early. I cannot stress enough. And also apply to as many schools as you possibly can when the application process starts. And when it comes to choosing your dental school, that will give you a little bit of upper hand. Like, do your homework when it comes to the dental schools. Where do you want to go? Where do you want to be for the next 4 or 5 years, or maybe more of your life, right? See the location. Right now, I, again, because of COVID, you're not going to be able to go personally, but thank you Zoom, thank you emails. Okay, go ahead and call, give them a call, talk to the program director, talk to if nobody else, talk to as many students as possible. Network, guys. It's going to be going a long ways. Keep your questions ready. Ask them questions like, when do the sim labs start? When are we going to be seeing the patients? What kind of residencies are there at the school? Because just in case you're looking forward to specializing or something, if that school, and if you know it already, which might change when you go to dental school, but if you are prepared for it, that also, like, dental schools are gonna look at it more positively. They're gonna be like, okay, this person wants to be here, right? So you are kind of putting yourself in a better position when it comes to getting selected and being a dentist, right? Alrighty, let's go ahead. Yeah, I'm not done with you yet. All right. If you can take away anything from this presentation, I would say remember this. Dentistry is profession of the people, by the people, and for the people. Good communication and soft skills are a must in our profession. Okay. And if you're not a people person, there's going to be a whole lot of misery for you for the most part and people around you, right? But having said that, these skills too, just like any other skills, is learnable. You can hone on it. So if you think that you are an introvert, you take time to open up to people, go ahead and start honing on these skills. It is, you are going to need it. Like I said, whether you work an associate, whether you open up your own office, um, how do you communicate with the patient, how do you communicate with the team, interpersonal skills go a long ways. People are going to look at you as a leader of the practice, no matter the designation. So you're going to have to be able to effectively communicate what is your purpose, what is your intent, what is the treatment plan you're presenting to the patient, and all that good stuff, right? And then not only just professionally, you need it for your personal life too. I mean, don't you want like boyfriends, girlfriends, partners? Come on. Communication skills are must, right? Remember that. Alrighty. Take care of your health. And okay, another thing, dentistry is physically, mentally, emotionally very taxing profession. We are blessed to be here, but it is very easy to burn out. So dentistry has one of the highest burnout rates of all professions. So I do want you to keep in mind. And then the other thing is that if you are not yourself feeling good and you're not healthy, how are you going to take care of other people? And that's the whole purpose of being in medicine, right? Just so that you can take care of others. And so take care of your health. Your priority, physical, mental, emotional, spiritual health, taking care of it is a must holistically, right? And the same thing goes with take time out to relax and enjoy. These years are some of the best years of your life. If you just work, it's gonna burn you out. You're gonna get drained out. Okay, and you're like, I didn't want to be in dentistry because of this. But no, like I said, dentistry is a beautiful profession to be in. You just have to be smart, stay close to your friends and family. These years you are going to be building some of the most beautiful, most long lasting relationships and friendships of your life. So enjoy it, slow down, soak in all the goodness the life has to offer in these years. Everybody grows old, and then those things are going to come your ways. So why the misery right now, right? And then seek help from coaches, mentors, other dental professionals. Please do not hesitate. Like, I know myself, I love helping people. Like, DM me anytime on my Instagram. I'll be more than happy to help y'all. And I like within dentistry, you're gonna find a whole bunch of people that are gonna be like, okay, yes, you need help, Rupa, I'll be here anytime. You just give me a call, Eunice, anytime. So seek out help, do not hesitate. Like, no question is a wrong question, right? And then just stay focused and committed towards your goals. Like I said, grit has to be there. You're gonna have to persevere. Highs and lows are going to keep on happening. When you're at the lows, then remember your purpose, remember why you started what you started, and keep on going. Once you remember that why again, okay, here to help people, then you're going to be just fine. Keep on going, right? All right, let's get started. Okay, now we come to the clinical side. So a typical day in general dentistry. So for me, like I said, I am currently associated with the DSO. Different practice models, the days might vary. But for me right now, I work on about 10 to 12 patients a day in 2 columns on my side. And then there is a third hygiene column where I go ahead and help my hygienist, and I do all the exams, and she does all the cleanings and stuff, and a whole bunch of other things too. uh, so periodic new patient exams, emergency exams, comprehensive exams. And then I do want to stress on this, for me, clinical side of dentistry, the first appointment when the patient comes to me, I spend a whole bunch of time with them, building rapport with them, knowing their expectations, why are they here with me, chief complaint, and then also holistically, comprehensively taking care of them. So it takes time. First appointment, I take my time with the patients, and then I practice bread and butter dentistry, fillings, crowns, bridges, implant restorations, a whole bunch of oral surgery. I love extractions and bone grafts, so I do them. Some root canals, removable partial dentures, complete dentures. I am Invisalign certified, so I do cases for Invisalign. Depending, we do have a oral surgery and ortho coming in our office once a month, but I do Invisalign cases too. And my favorite part of the day is when I'm working with kids. I enjoy working with kids. Kids are fun. um, so same things, everything, when it comes to comprehensive dentistry for pediatric patients, along with stainless steel crowns, space maintainers, whatever they need. And then preventive treatments like preventive resin restorations, sealants, and these days a whole bunch of night guards, COVID, I guess everybody is diet is thrown out of whack, the morning routines are gone, and people are grinding their teeth like crazy, so a lot of fractured fillings and teeth and all that good stuff. So I tell my patients, you have they spend so much of time, pain, and energy getting their mouth fixed, so we want to save whatever dentistry is done in their mouth and their teeth. So night guards. And then, like I said, I work in very close collaboration with our oral surgeon and ortho and other specialities. I have a respect for all of them. I If I need them, I do. Like if I feel like, okay, this smaller endo is going to be better off with the endodontist, or the retreatment is going to be better off with them, I will refer that patient out in their best interest. And the same thing with primary care physicians. The first appointment, like I said, when I'm working on the patient taking their doing the comprehensive exam, or for that matter emergency exam too, I do take care of their, I see them like the whole person, not just the mouth. So medical history, very very important. If I need medical clearance, I am gonna get it. I am gonna be working in close collaboration with the primary healthcare providers, right? Alrighty, let's go. What kinds of complaints do patients present with? Okay, a whole bunch. A whole bunch. So the patients are going to be like, okay, doc, I want exam and cleaning. That's like the basic stuff. But then I have pain in my teeth. My jaws hurt. My filling broke. My tooth broke. Trauma patients, they're going to be coming, like I said, grinding fractures, or somebody fell down, or the kids were jumping on their trampoline, butted heads, and then these, before you know it, this tooth fell out or fractured or something. If the bones break, I am going to do the triage at our office, but then I'm going to go ahead and refer the patient for the major stuff to oral surgery or emergency or whatever they need. Or sometimes the patient is going to be like, my teeth are crooked, I do not like how I smile. That's a big thing when it comes to our profession. My teeth are yellow, right? I need my smile to look good. Or the patient is going to be like, okay, I have this big hole over here, just pull my tooth out. Or I need root canal, I know I need crown. So a whole lot of, like I said, Google brother is there at service with everyone. So a lot of the patients are going to come with their own diagnosis, and then let us know. Of course, we're going to see like what's going on. And then my gums bleed when I brush my teeth. I have sensitivity on my teeth right over here by the gum margin. There are lesions called non-carious cervical lesions that are like not made because of cavities, but if somebody is aggressively brushing or a whole lot of other things can lead to that, that's going to lead to hypersensitivity also. And then we also see patients who are referred from other specialities. Like ortho is going to be like, doc, this patient needs the first premolars out, because we're starting for ortho. I I need space, go ahead and extract. So I'll go ahead and extract them. Or one of our sister branches, they're going to be like, you like pediatric patients? Go ahead and enjoy. So they're going to send them my way. Or one of my friends is going to be like, okay, Neha, go ahead. And I'm going to be singing songs and stories to my pediatric patients, enjoying with them. And sometimes parents, they don't want to get the child sedated on a serious note, or for them to be taken to the pediatric dentist and under GA and all that. So they want to try it out, that maybe sometimes a different dentist, a different face is they're gonna be able to work. So I do I do work on a lot of referrals like that. And then sometimes the patients are going to be like, I just need a second opinion, or they are in the marketplace, like dental insurances are a whole another story. So sometimes the patients are going to be like, okay, or they are just marketing around, or I didn't have rapport with my other dentist, I am looking for a new dentist, so I'm going to be seeing patients like that. So these are the major complaints that the patients present with. Okay. All right, diagnostic tests and instruments used. So for diagnostic tests, the most important thing that we are going to be needing when it comes to diagnosis is our dental x-rays. And I am OCD about it. And for my assistants, I don't ask for much more, but my x-rays have to be on point, just so that I can diagnose properly, comprehensively. The first x-ray you see over here is a periapical x-ray. Krupa, if you want to show, honey. Yeah, these are our periapical x-rays, and these are taken straight on. So periapicals, we want to see the whole tooth, and then 2 millimeters beyond the root tips, just so that we are able to see if there is any infection going on, if there is bone loss. You can see over here on this one, there is a little bit of sinus showing right by the roots of the molars. So periapicals are done for those. Second picture is interproximals. They are also known as bite wings. Bite wings are mainly used to diagnose for cavities that are there in between the teeth, and then also bone loss, to see if the tooth is restorable or not, like after root canal, if we are going to have to do root canals or not. And then also, once we are done with the crowns and bridges, to check the margins of these things. All right, and then the third x-ray is called panoramic, and you can see this is like a two-dimensional image of the whole jaw. You can see a whole lot of the jaw's teeth structure, a whole bunch of anatomy going on over there. You can see the inferior alveolar nerve in relation to the mandibular molars, where it's going. If the wisdom teeth are impacted, the oral surgeon is going to want to see that if there are any lesions, any cysts, any tumors, anything going on. We need our panels for those. For kids, we're going to be able to see how far along in development the child is, where are the permanent teeth, if there are any permanent teeth that are missing or not, kind of a thing. Okay, and then the next one is occlusal. Occlusal x-rays, I don't really take a whole bunch of them, but they do have indications, like if there are any fractures. They are used to see cleft palate. They are used to see, like in these pictures, if the child is little and they are not able to take periapicals or bite wings, we're going to be like, okay, let's see where the permanent teeth are in development. We'll just go ahead and take occlusals. And cephalometric is mainly used by ortho. And over here, you can see a whole lot of hard tissues and also soft tissues. So how is the growth of the face and the skull and the jaws going in relation to each other? Over the years, we can compare the cephalometric from last year to this year and see like how far along in development we are. Where are those adenoids? How far along they have shrunk? Where is the tongue in relation to the bottom teeth, all that good stuff. CBCT is a beautiful technology that we have in dentistry. I wouldn't say new, but it's a wonderful thing to have if somebody has in their office. This is basically a three-dimensional image. All the rest of them are two-dimensionals. So in this one, you're gonna see the x-rays are cut in like tiny little sections. So like, for example, the oral surgeon is going to be able to see, okay, I'm going to be placing implant. What is going to be the length of the implant? What is going to be the width of the implant? Can we even place an implant? Is there any bone in there? And also, if there are any lesions going on, the endodontists are going to be able to see accessory canals in there, right? Or calcified canals and things like that. So a lot of indications, beautiful thing for somebody if they have it in their office. It's a nice thing to have. Alrighty, let's go. Okay, so this picture, a whole bunch of stuff sitting over here, and we are not able to see the thing completely on the side, but I'll just reiterate it for you. Mirror, probe, and explorer. The probe is the yellow portion. I'm showing the things on this tray with purple paper. The instrument in the middle with the yellow color, yellow portion is the probe that is used for measuring perio pockets. The other side is the explorer that is used to diagnose and catch for decay. The third thing, I guess it was written, was intraoral camera, but I'll just keep on showing these pictures. This thing over here, the blue thing, is called the tooth sleuth. Tooth sleuth is basically used to diagnose cracked teeth, and if there is a big fracture going on, you can tell. The patient is going to be like, okay, the teeth are moving. But if it's a little one, we ask the patient to bite on it, and then the patient is going to be like, ah, it hurts. So that's how we know that the tooth could be fractured. And the other thing that goes along with it is this light over here that's called that's used for transillumination, and you can see that the fracture line is very, very clearly visible over here, going from the top till the bottom. So a tooth sleuth and this transilluminator is used for basically cracked teeth syndrome, right? Coming back to the purple paper, you see the white bottle with the red cap. This is endo ice. This is coltine. We spray it on a small little cotton pellet, and when you spray it on it, you're gonna see like white little fuzzies forming on top of it. And we basically put it on top of the tooth that is hurting or non-hurting. The whole point is to check for the vitality of the tooth, whether the tooth is alive or dead, in simple terms, right? If the nerve is inflamed or not, kind of thing, right? And then we have oral ID is our oral cancer screening device that we have in our office, and we try to use it almost on every single patient. This is a beautiful diagnostic tool to have to catch oral cancers early on. And we're going to shine this light on oral mucosa, and healthy mucosa is going to look different than the non-healthy mucosa. And if there are any lesions going on, if there are any symptoms going on, any ulcers that are not healing, I will send that patient pronto to oral pathology or oral surgery to get the evaluation and treatment done as needed, right? And then intraoral cameras are, I love intraoral cameras, right? Are, so for me, I use it again on every single patient almost. And even during the procedure, sometimes the patients, they want to see like what's going on in their mouth, right? So we click pictures, show them on the big screen. Everything is nice and clear. It helps with patient conversion, helps with treatment conversion. We are able to show them, hey, this is why we recommended this treatment. These are your treatment options, so the patient can make an informed decision, right? So this is the single most important thing. Like, I would say, if somebody is opening up their office or anything like that, if you want to invest in something, this should be the first thing that you want to invest on. So intraoral cameras, beautiful diagnostic tool under our belt. All right, let's go. New technology in general dentistry. So dental world is made up of rock stars. Right, we have something new coming up left and right. There is research going on, always, right? Lasers are not new, but this is a beautiful piece of technology that is comparatively new that we have in our office. So I wanted to talk a little bit about lasers with y'all. And basically, lasers is light amplification by stimulated emission of radiation. All that means is that it's light at a particular wavelength that is used for different things, surgeries on hard tissues and soft tissues. So the good thing about lasers is, for the most part, sometimes you don't even have to anesthetize the patient, so no pain. Laser dentistry. So this is a beautiful thing. This laser that we have is BioLase, and I mostly use it for soft tissues. The main things that I'm going to be using it for is for my crown prep procedures, called gingivectomy or troughing, when I'm taking the impressions and all. And also it is used to control the bleeding, for hemostasis, and also implant recovery. Our hygienist uses it to disinfect perio pockets, a whole bunch of things. Oh, I also use it a lot, many times. A patient is going to come with an aphthous ulcer, that's like a canker sore, or herpetic ulcers. These things are very, very painful. So I just go over and hover around those lesions with my laser tip, and the healing time reduces almost like more than a half. The patient is not in pain, and I don't have to anesthetize them again. So all these good things, a patient is appreciative. Of course, people come to us just so that we can take the pain away. So this is a beautiful thing. I use it all the time for these things. And then the other nice thing, with lasers, is frenectomies. Like if the patient got ortho done, and originally they had gap in between the two teeth in the front, this little tissue inside, if it's going in between those teeth, and mostly it is, at the end of the ortho appointment, we're going to go ahead and shred those fibers away. Again, no anesthesia needed, just so that though that gap doesn't come again. Or like if a child has a tongue tie, right, they are not able to eat properly, they are not able to swallow properly, they are not able to talk properly. So we go ahead and shred those fibers with lasers, and then they are able to do all those things. So lasers are a beautiful thing, that we have new piece of technology in our office. All right, let's keep going. All right, now I am going to talk about a little bit about crown prep setup and a couple of cases related to that. And in this picture, again, the single most important thing in this picture that I want you to remember and take away from is that piece of paper that is sitting on the right side on the counter. That is called our consent form. The patient comes for any kind of treatments. You want to make sure that you are reiterating to them what is the tooth that we are treating, right? Why are we treating it? What were the options? What is the treatment that you are giving? All the pros and cons, risks and complications, just so that when the patient is reading through it, and I verbally tell the same things to the patient too, just so that they made that decision that is an informed decision, and the patient knows everything, they're comfortable. So that is the most important thing sitting when it comes to crown prep setup, for all the cases. For that matter, anything that you do in patient's mouth, you have to have the consent. Same thing, we are going to get the consent for the laser too for the patients, because dentistry is a noble profession, but there is going to be a whole bunch of people who are going to be ready to sue for the littlest of things. So, and there are pros and cons to every profession. In our profession, you have to save your butt, and you have to be keeping the paper trails nice and good, with the treatment notes and consents, right? And then you're gonna see like my laser is sitting right beside me, and then all the green eyeglasses. That is like the other most important thing that I wanted to show the doctor, the assistant, who and the patient, or whoever is in the room is going to be wearing those green glasses, uh, because the lasers, they are bad for the eyes. If accidentally it goes, people go blind with it. So they're gonna need to wear that. I'm gonna go over all the materials that are shown over here, all the guns and everything, in our cases. Maybe Kripa, we can move ahead, honey.
Okay.
So the patient comes to me, the first thing, like, I'll get the consent, and then I'll take the putty impression for them, for the crowns we're talking about, and then I numb up the patient. This case one, my patient came to me and she is like, doc, I am hurting every time I chew, like this tooth over here. You can see the first x-ray, number 18 is a crown, and she's like, every time I chew, I'm hurting on that tooth. I know there is something going on, and I look at this x-ray and there is a marginal discrepancy. I'm like, okay, I here is the thing, I this is a two-dimensional image. More than that, this is a porcelain fused to metal crown. The x-rays are going right through it. I'm not going to be able to know how far along the decay goes underneath that crown till I section that crown off. So I let the patient know everything beforehand, that if the decay is touching the nerve, then we might need to do root canal, or if it's closer to the bone, then we might need to go ahead and get crown lengthening procedure done before we are able to do the crown, the redo crown. So she's like, no, you're not doing any root canal. I ain't doing any crown lengthening. Go ahead and pull the tooth out. I'm like, okay, fine, as long as you know. Okay, so she gave me the green flag. So I'm like, okay, I section the crown off. I take another x-ray to again show it to her, and you can see the dark underneath the white on the x-ray is all decay. And over here, on the front side of the tooth, you see how close the nerve is to the decay over here. So I told her, like, I'm gonna try, once I'm done taking the decay out, I will let you know what we're gonna do about this tooth. So but once I did take the decay out, there wasn't any frank exposures. So I did pulp cap over there, and then I, on this picture, you're gonna be able to see the white is the filling on top, and then I redefined the margin. So once the margin is prepared, once the tooth is prepared, the next step is we wanna retract the gingiva. Okay, there are a couple different things that we use in this case. I overkilled it a little bit because this was a redo crown, and patient did not want to save the tooth if we needed to do the root canal or anything more with this tooth. So I went ahead, this little string thread kind of a thing that you see is called a gingival retraction cord. So basically a couple different sizes it comes in. We're going to use the smallest size for the vertical, and then we're going to put like 0, 1, 2. So the 0 is going to go all the ways in, and then 1 and 2 are going to go on the top. So the 0 is going to give the vertical to the okay, how do I say, the tissue is going to move away vertically, and then with number 2 the tissue is going to move away horizontally. The whole point is that when we're going to take our impression, the gum tissue is away and the impression materials goes in a little bit in the gums, just so that when the lab is making our crown, they have enough flash material or extra part that they are able to see the margin of the crown properly, right? And then over here, like I said, I did the overkill. I put some Truxident in there too and had the patient bite on the cotton roll. I'm like, okay, go gingiva, go. So we moved the gingiva away. I took everything off, washed the tube, and this is the impression that we took. The yellow is a light body polyvinyl siloxane material that I put on top of the tooth. That gun is in my hand, and then my assistant is going to load the orange medium to high heavy body in the tray and give it to me. I'm going to put it on the tooth, patient bites on it, it sets in about 2 minutes, I take it off, and this is a good impression. Okay, So we don't have any StatX or CAD/CAM milling machines or anything in our office over here. So we send our impressions over to the lab in a couple weeks. This is what the lab is going to send, this picture on the top right. With the crown is going to come back on a model and a die. This is what it's called. And then I go ahead and try it in patient's mouth. These are not the same cases, but I didn't have any pictures, so I thought just to show you. So I'm gonna try the crown excuse me, in patient's mouth. If the margins are looking good on the x-rays, if the interproximal is good, if the bite is good, then I go ahead and deliver it permanently. So this is all good. This tooth was saved. This patient is happy. We did not have to extract it. I was able to save it without root canal, so all good. All right, let's go on the next case. So this is almost the same. This is a redo crown case I had for you all too. This patient is in his 70s, and the patient comes in. Whenever I eat food, it gets stuck in between my wisdom tooth and the molar in front of it with the crown. And as you can see in this x-ray, the tooth has the tooth with the crown. Underneath the crown on the backside of the tooth, this is all root decay going on. So for this patient, I told him that I do recommend that we go ahead and extract the wisdom teeth. We are going to get evaluation done with the periodontist for crown lengthening, possibly because this is close to the bone over here, and also close to the nerve, because the patient was in pain too. So I'm like, we're gonna get the evaluations done. Most probably we're gonna get both these things done before we can redo the crown, or we might have to extract it. So the patient is on board. He's like, okay, let me go ahead and get the eval done. The periodontist and endodontist are on board. The periodontist went ahead and extracted the wisdom teeth for these patients, and then at that time he came back to me and he's like, okay, doc, you can go ahead and get this crown off. The endodontist and the periodontist, before crown lengthening, they wanted me to take the gross decay out, just so that they can see like where approximately the margin of the crown is going to be when we redo it. So over here, as you can see, I have my diamond burr right over here. This crown is also a porcelain fused to metal crown. For porcelain, we use diamond burrs. For the metal part, we use carbide burrs. Sometimes I cheat and I use carbide burrs. 330s come cheap. So I'm like, okay, just keep going, kind of a thing. But this saves a lot of time and misery for myself. So you go ahead and section the crown. You can see in the next picture, I sectioned the crown off. Once the crown is off, now we can see how deep that decay is. It's going at the backside of the tooth. You can come down right here. The black that you see, this is the decay that we can see on the x-ray, and you can see that this gum tissue is coming right on top over here. So, and then once I took the crown off, that's when I could see that the decay is going almost all around the tooth that I wasn't able to see on the x-rays. So in this case, I did go ahead and use lasers before, just so that I can easily and clearly visualize how deep the root decay is going, and I'm able to do what I'm supposed to. So I basically did the gingivectomy over here at the back side. You can see like the tissue looks a little bit different. It was bleeding a little bit, but again, with lasers, the bleeding is not as much. It comes under control really good. I took all the decay out, put the temporary filling in, and then put the temporary crown back up in, and sent the patient to endo and perio to get the rest of the things done before we do the redo crown. So these are my 2 cases for you for today. Alrighty, so final advice for all of you, all wonderful people. I would just say, just keep a growth and learning mindset on. Sky's the limit in our profession. You can do so many things. Be patient and consistent towards your goals, and you will persevere and succeed in life in whatever you want to do. So just keep going, and you are going to be fine. Thank you so much for listening to me. Yes. Any questions, guys, go ahead and ask. I did wanted to include, like I said, anytime you all have any questions, please do not hesitate to DM me. Either this is my Instagram handle at DDS Coach, or my website, www.dentistcoach.com. I do have my email, my phone number, everything in there for you. Go ahead and reach out with anything, and I'll be more than happy to help. Okay. Alrighty.
Thank you so much, Dr. Kapila. I think Yuna might have some questions from the YouTube live chat.
Yes. So yeah, thank you again for that presentation. That was very informative and so much, interesting information. So due to the time, I think we won't be able to get to all the questions, but feel free to, like Dr. Kapila shared her Instagram here, so feel free to reach out to her. But I guess one of the questions that we can ask was, how was your training different in India from the US?
So I guess in India, guys, the whole setup of dentistry is very different. First of all, there is, and I'm talking like when I went to dentist college over there, it was 1997, and there was nothing called dental insurance in India. Right over here, like a lot, and mostly the patients are going to come like, I'm in pain. So patient education or hygiene wise, not a whole bunch of things. Mostly like we used to extract and restore partials and dentures, mostly, of course fillings and all that good stuff too. But when I came over here, like I said, and started to work with Dr. Davis and his team and all, I see that um, uh, the types of patients that we see over here is very different than what we see over there, because mainly the awareness as far as oral hygiene goes, as far as dentistry, and now things have changed quite a bit, but at that time it wasn't like that. And then there was nothing called dental insurance in India. So the whole business setup, the model, how we practice in India was very different, like that, like how you are going to be charging the patient, what kind of procedures they're going to be coming for, so all those things. So mainly like seeing the patients the same day in emergencies, nothing called scheduling. Yeah. So I think that was a main important thing.
That's interesting. Another question that we have is, did you get a chance to learn about the lasers in dental school?
We did and did not, kind of a thing. And that is something that you're gonna have to, like when I said that when you're talking to people and when you're talking to the program coordinator, these are the things that you're gonna be asking them. What kind of technology do you have in your school? We did learn about lasers, but in practice, the current DSO that I'm working in, that's where I started working with lasers. But again, continuing education courses these days, a whole bunch of them, you can learn anything by yourself. Yeah,
And do we have enough time for one more question?
for sure. I'm all yours.
Okay. So you mentioned previously that dentists have the highest burnout rate. Why do you think dentists have their highest burnout rate?
So here's the thing, like I said, we do want to work smartly. Hard work is very important, and there is no shortcut around it. You have to work hard. But along with that, in dentistry, why I said that is because it's, our profession is very hands-on. We are on our feet, bending backwards. Even if you're sitting and working physically, it's taxing. And then we're working with people. Anytime you're working with people, different kind of behaviors, different kind of people, so emotionally and mentally it's very taxing. You are like concentrating on that tiny little thing in your mouth that's called tooth. There are all these muscles and tongue and saliva that is going around, so you have to focus. So all these things, like for a couple days fine, but then when you're doing these things day in and day out, day in and day out, it can get very physically taxing if you're working long hours for years and years at end. And again, financially this is a good profession to be in, but getting to that point, the first couple of years are going to be grueling. So you're going to have to be smart about it, and a lot many times we are enthusiastic, we want to help people, and I went through that too. I can say all these things because I went through all of that too. You want to be able to give your very, very best. And sometimes in doing that, we forget that we are also human beings and there is a limit to what we can provide too. So that's why I said that. And research shows that dentistry does have one of the highest burnout rates of all professions. Yes, unfortunately, but it is.
Alrighty, thank you so much for answering those questions, Dr. Kapila. I think that's all the time that we have here for today, but we wanted to thank you for joining us and presenting this very insightful presentation. And I want to thank all the viewers for tuning in. We'll be posting our attendance quiz in the YouTube live chat, as well as our group meet and on our Instagram bio. And this quiz will remain open for 12 hours for anyone who wasn't able to watch. And so thank you again, Dr. Kapila, and thank you everyone for watching.
Guys, and good luck with all your future endeavors. You all are going to do great. Wonderful.
Thank you.
Talking to you all.
I
Bye
hope everyone has a great rest of your weekend.
bye. Bye bye.